Thank you for choosing the Professional Academy of Clinical Thermology for your thermal imaging needs. In this video, we will explain the report system and understanding the report for both doctors and patients. The most important part is the initial form survey that you will fill out online. The form is very in-depth and gives our interpreters good information to make the proper interpretations for your findings. Please fill this out at least 24 hours before your examination, as there are some actions you need to take before your examination. Notice the crisp image quality in these images. Our technicians and labs are required to use the latest equipment in the field and bring you the best possible imaging that we could provide. We encourage you to compare our technology to anyone else in the industry. Okay, this is the cover page to our report. This is the meat of it all here. And as you can see at the top of this, there is 3 factors. There is the thermal inflammatory factor, we have the oral inflammatory factor rating, we have the hormone toxicity rating. And as you can see, they are listed as numbers 1 through 10. In this case, they are all 7. But in our database, where we have tens of thousands of patients, we have derived this rating factor based on that. And below those 3 factors, we have the cerebral vascular screening number. That number in the bottom right corner at the 0.25 in this case is the delta T difference between 2 areas on the forehead that we measure. It's a function of the supraorbital artery, which is a function of the internal carotid artery, where we're measuring carotid artery possible occlusion, and we give you a rating of normal, borderline, or needs further evaluation. One thing to keep in mind here is that other things can create an off reading. This is a screening test and needs to be understood that way. You may need further information or further thermal testing. To the box to the right, it says important information, a note to the physician. This is to help them understand, and if you're a doctor listening, please understand that this is a tool to point you in the right direction. It is showing areas of inflammation, not much different perhaps than taking a temperature of the body, but getting more specific location information out of that. In the case that you do not have a doctor who understands this sort of imaging or physiological testing like this, or does not want to learn, we do have consultations available through doctors in thermology. We have a dentist, we have a breast interpretation, and general thermology. The next pages include various body regions. In this case, we have head, neck, lymphatic congestion, the TMJ, the temporomandibular joint, and the thyroid. We have a description of each area, the findings commonly found. They are only positive if there is an X through the box, and only if they are positive does a differential diagnosis apply. In this case, you can see these are various possibilities of oral inflammation. The follow-up that is recommended, and as well as any other recommendations. And we further, along the same lines of thinking, we have the abdomen, spine posture, lower extremity, all with the same findings or possible variations of findings. The next page is either the breast study, as you can see at the top, or for men we offer testicular screenings as part of our full body screening. Individual testicular screenings are also available. The results are listed as shown: the findings, the differential diagnosis possible, the follow-up, and other recommendations. Thank you for watching this video. For more information, you may call 877-997-4262 or visit www.medicalthermology.org.